give us a second to get the power. Great. Well, it's a great honor to be here, and I thank you for that very generous introduction, and I am honored to be one of you and to both wrestle with and hear about the issues that bring us together. I've worked with family organizations for many years, with researchers and with policymakers, and I'll try to develop the theme today that we have a coming together of very sound science that leads us to think we can do very effective preventions for families facing adversities. We have a lot of practical, clinical experience, and we, in many different ways, have partnered with families and learned a great deal from them. So I'm torn because I almost would like to not give this talk and just have a discussion with you. But I think I will tell you some of the kinds of journeys we've been on, really only so that you can see whether they would be helpful to you. I'm really honored to be here as a guest, of course, the family organization for recognition, care, equity, and also with the various support from the academic and ministerial side. And I think those kinds of partnerships are equally important. In Massachusetts, we have the organization PALS, the Parents Advocacy League, which is the Massachusetts branch of the Federation for Families. You spoke about it. You know, I came in and they put this green ribbon on me, and I thought to myself, no, this looks exactly like what we do in the States. It's the same ribbon. Anyway, and I also am very pleased to see old friends, Dr. Bonnie Ledbeater and Ron Barr, new friends like Dr. Robert Leeds and Kelly Anderson, and I look forward to getting to know more of you through the day. I'm particularly honored to speak at an event sponsored by a family organization because I think one of the things that happened to us as we started to develop and evaluate preventive interventions for families is we were tasked sort of in the role of experts as intervention developers, but it very quickly became clear that the parents were the experts. They knew what they needed, they knew what needed to go into interventions, and even more importantly, I or anyone else could say anything about what we thought people needed. But it's not what we think people need, it's finding what they do need and helping them realize it. And I think that's sort of the aim of what we've been doing. Now, I'm also pleased that policymakers are here. I think we need to think about systems and policies. And the two paradigm shifts we're trying to work on in the States is a shift away from individual-centered care to family-centered care. That means finding funding streams. It means finding organizations that can do that. And also a shift away from a focus on individual diagnosis and a much broader health promotion and disease prevention orientation, including mental health. I'll talk a little bit about the Institute of Medicine's report on the prevention of mental illness in children, youth, and families that just appeared last month. I was on that body, and again, another theme in my talk will be that the science is very much on our side here. It really can help us a great deal. I've also had the opportunity to work as a clinician for more than 30 years at Children's Hospital in Boston. And if you were to ask me what is prevention, I'd say there were two experiences that I had that led me into prevention. The first is working in our emergency room and seeing lots and lots of kids addicted to drugs after suicide attempts from very difficult families, and realizing that to wait until children get to that kind of extreme condition is to wait too long to really help them. We need to reach out further upstream and keep those things from happening. I think the second was that in the first study I did, which was a study of children growing up in homes where parents had mental illness, we did interviews with the kids, interviews with the parents, and almost to a person, the parents said, you know, I'm worried that I've irrevocably damaged my children, and I'm completely alone with it. No child is irrevocably damaged. There's much we can do. And I think that led me into trying to have conversations with families about how to find strengths and move on. And at the risk of giving everything away, I'm going to give you my summary slide first, so you can think about it. And this slide is written as one would from a clinician, but you can turn it around and think about, as a family member, how you would use it. I'm a clinician I'm a parent, and I'm also a family member with a number of individuals in my family who struggle with mental illness, so I've been down that road as well. And I'll develop the theme that if you really understand something well, you should be able to explain it in simple language and have people be able to use it. So the book that I wrote is actually a book for families. And at the end of the handout today, there are these little 4-pagers, which we developed as part of the project to work in Head Start, but not to work as clinicians in Head Start. These are documents for teachers and parents to try to think about what we know in mental health and how it might be helpful to them. So the things that I think are important as we think about developing programs are understanding the context and culture of a parent's life, aligning resources to support parenting. I think people who are parents first. They may have mental illness, they may not. But the dominant fact of the mental existence of parents is the lives of their children. And we need to orient our care systems that way. And by the way, I don't have 4 children. My wife and I together have 4 children. But I think we need to think about that as the key preventive effort that we need to engage in. And we can talk about all kinds of adversities besides depression. But that's how we need to be oriented on here. I think treatment is important. Most of the data suggests a lot of parents with mental illness don't get the treatment they need. A lot of adults with mental illness don't get the treatment they need. And most kids with mental illness don't get the treatment they need. I think an extra engagement for parents when they're depressed is helpful. I'll develop throughout the day that the focus on hope is central. I think engaging parents in existing programs such as Head Start in my country, or in food stamps, WIC, or even in regular school visits, and add existing enrichment to that. And I think developing partnerships is key. So what really is depression? I think more than anything else, depression assails a sense of hope. As one mother said to me, depression attacks the soul. In our encounters with depressed parents, we've more and more found that finding hope together, legitimate hope, as much as can be done. And this is a quote from James Agee. He wrote a book in the 1930s about the ravages of the Great Depression and the Dust Bowl called Let Us Now Praise Famous Men. This was about the birth of a sharecropper's son and daughter, or a sharecropper and his wife's child in the 30s. The child is the bearer of whatever the future shall be. At this center, his incomparable tenderness to experience, his malleability, the almost unimaginable nakedness and defenselessness of this wondrous 5-windowed bird and core. I think Agee captures the promise in the birth of children, sense of hope. And, it's also interesting that this has become one of the great classics of sort of American social literature. But when Agee published this book in the 30s, it only sold 600 copies. And it was only in the 50s when it was revised. For those of you who are working on things or writing things, don't give up. Things will come around. And then I've had the privilege for 3 decades to work with Julie Richmond. He passed away last summer, but he was the chairman of Children's when I went to work there, and we worked on many projects since, including Head Start. And as we talk about genomics and all of the wonderful neuroscience that's emerging, it's important. Julie wrote first in a pediatric textbook. We used it in an article, or in a chapter we've rewritten now 8 times for a pediatric textbook. But Julie said the pediatrician can regard the family as carrying the chromosomes that perpetuate the culture and also form the cornerstone of emotional development. This is why we need to pay attention to families. This is why boards are so important. And this is why all of you coming together is important. Now, just a thought about prevention, be it mental health prevention or physical health prevention, or we do much better with physical health prevention because we have strong traditions of well baby care and so on in pediatrics. I think prevention requires a paradigm shift. It means asking the question, what does the child need 1, 3, and 5 years down the line, rather than what does the child need right now right now in the moment. I think mental health and physical health are inseparable, both in terms of illness and in terms of health promotion. And health promotion and prevention need to be considered together.